Greetings. Now, I want to talk about a condition whereby the baby dies in the womb. It is called intrauterine fetal death. In this condition, the baby dies in the womb and it's usually above, this baby's age is usually above 20 months. You understand? If a baby dies in the womb after 20 months of carrying that pregnancy, it is called intrauterine fetal death. And the purpose of this video is to tell you what can cause it. I have about 10 things in my head that I will explain to you that can cause intrauterine fetal death. The one we say, the baby died in the womb. It's a very unfortunate event, quite all right, but I need to let you know why, right? So that if you have made that mistake before, it will not happen again. The number one reason that you can have intrauterine fetal death is this. Pregnant women that smoke, pregnant women that take alcohol, yes, they can have intrauterine fetal death if they are carrying a pregnancy. If you are pregnant and you are smoking and you are taking alcohol and you are using herbs, your baby may die in your womb. It's not what I pray for you, but I have to tell you the truth. If you are anemic, your baby is also using your blood, right? Your PCV is not up to 30%, it's like 20 or even 25%, and you are sharing that small volume of blood with your baby. It can cause intrauterine fetal death, right? That is another cause. If you are using herbs, you are inserting herbs, you are drinking agbo, you are taking all sorts of herbal preparations, it can cause intrauterine fetal death. There's a condition called placenta abruptio. In this condition, the placenta is separated from your womb. You know the placenta is attached to the womb, right? In this condition, the placenta may be separated from the womb. And when this happens, the baby dies. It's called placenta abruptio. Another reason your baby may die in the womb is when there is a birth defect. There are some very bad birth defects that nature will just, okay, this baby cannot survive even when the baby is born. So the baby dies in the womb. Some babies, especially if it's a birth defect that involves the heart, the lungs, yes, so the baby can die in the womb. It's a cause of intrauterine fetal death, birth defect. Severe birth defect is a cause of intrauterine fetal death. Infection like UTI, malaria can cause intrauterine fetal death. Any infection that can cause you fever can cause intrauterine fetal death, right? I don't know if I've mentioned everything. There's a condition, like I mentioned the other day, I said something about cats. How pregnant women should stay away from cats and their feces, right? The reason is that cats carries an organism called toxoplasma, and this toxoplasma can be transmitted through the placenta to your baby, and it will cause toxoplasmosis, and toxoplasmosis can cause intrauterine fetal death. You understand? Diabetes, women that are living with diabetes is very common. Pregnant women with gestational diabetes, yes, they may have intrauterine fetal death. I'm not saying these things so that you will become scared. I'm saying these things so that you'll be educated. So that when you know that you have this condition, you'll be frequenting the antenatal clinic quite often. I don't know if I've been able to mention everything, but just know that if you have, the baby can also have infection. Any infection that affects the baby can cause intrauterine fetal death. One thing I also need to tell you is trauma. There are some pregnant women, they get involved in accidents. When they are pregnant, they get involved in an accident, and because of the accident, their baby can become injured and the baby dies. So it's a cause of intrauterine fetal death. I have mentioned infection. I have mentioned use of alcohol. I have mentioned smoking as cause of intrauterine fetal death. Baby dies in the womb. I'm telling you of the reasons a baby can die in the womb. And forget this intrauterine fetal death I'm talking about. This is just is a medical word for why raising baby can die in the womb. And intrauterine fetal death occurs when a baby dies when it is above 20 months of pregnancy. I hope this is understood. I mentioned anemia. When your blood level is too small, baby can also die in the womb. Also, when there is genetic defect, the baby can also die in the womb. Another reason a baby can die in the womb is resource incompatibility. when your husband resource group and the woman's resource group are not compatible, the baby can die in the womb. You understand? When there is infection, when there is oligohydramnios, when the water in the amniotic sac is too small, the baby can also die in the womb. If the water in the amniotic sac is also too much, the baby can also die in the womb. Infection like UTI, any infection that can cause you fever, the baby can also die. It can make the baby die in the womb. So what you need to do when you are pregnant, that's why it is very important that you always do ultrasound scan when you are pregnant to check the well-being of your baby. If you have any question in the comment section, please let me know. Put it in the comment section. There are some women that have experienced this before, so they know what I'm talking about. Intrauterine fetal death. It's a very terrible event. Please, if you know anybody that have had intrauterine fetal death, that was pregnant and you later heard that the baby died in the womb, what you need to do is to comfort them. It's a very terrible event. There are some women when the baby is 30 weeks, about 7 months, the baby dies in the womb. 8 months, the baby dies in the womb. There are also conditions where baby dies in the womb when it's even 9 months, when it's just time to deliver the baby. It's a very terrible event, and it's not something that should be joked with. It's a serious thing, and it can cause the woman serious crisis. So please, let's all watch it. Let's all live healthy life, especially for pregnant women. Take your antenatal medication. Do ultrasound scan regularly. You understand? If you are diabetic, be taking your sugar drugs. Be taking your antenatal drugs. Don't use herbs. Don't smoke. Don't take alcohol when you are pregnant. Follow the instructions of your doctor. If you have UTI, treat it seriously. And treat it immediately. It's an emergency. If you have malaria, treat the malaria. If you have pneumonia, treat it. Go to the hospital and let it be treated. Any form of vaginal discharge, treat it. Thank you.